So why nurses is a really important question, you know. When I was chatting with Cheryl before that, one of the lessons I've learned is if you're not in the table, you will be in the menu. And it's really a fact because nurses are the ones who bear witness to everything that goes on a day-to-day basis. Whether you're working in an ICU setting, whether you're working in community setting or post-op, pre-op, outpatient, any level of care, you are the eyes and ears literally there on the ground. So there is a lot of observation and data point. And nurses, you know, it- have that unique opportunity to literally know what works, what does not work, how we can make this system better, etc. So when we, this is the little poster the staff made during COVID, in one of the group homes I work. Not all superheroes wear capes. Some wear everything else. This is not only for my group home, it is true for all over the planet, anywhere. Literally, the nursing staff had COVID positive. They would sleep upstairs and take care of the folks downstairs. When I say nursing, I'm a little bit broad from registered nurse to CNAs and all the levels of which comes under the broad rubric of healthcare. This is what I witnessed. So there is something about the healthcare profession and nursing especially, which kind of draws people to that kind of care. They have a way of connecting with people, even in the darkest time, most suffering. And then they have a way of practicing compassion. And often they don't talk about it. They don't talk about it. They don't talk about the observations they make or translate what they are seeing. And yet somehow they make it happen, right? So with this as the context, I just wanted to ask myself, why nurses? So, for example, Gallup, there are close to 3 million registered nurses in our nation, right? United States. So when a Gallup poll was conducted, I think it was a few years ago, nurses ranked highest for honesty and ethical standards. And I don't have to repeat this because that's how we trust our nursing staff. Even a physician can write an order and go. Ultimately, it's a nurse who makes that happen, right? And the people who ranked the lowest among honesty and ethical standards were people, legislatures, and congressmen. So, but most of the decisions that are made at the level of Congress and legislature or whatever the policy making body affects the work of nursing staff. I'm using nursing staff or healthcare staff, etc. Yet we see, of course, there are some nursing staff who are in the policy making and legislative level and, Congress, etc. But proportionately, not many are there in the field. Yet every decision that is made, whether it's a legislation, etc., affects the work that nurses do, healthcare people do every day. So when you say broadly policy, we often think of a law or a nursing policy or your organizational policy or local government policy. But what is it after all? Policy is a broad range of activities. It's almost like an agreement that we make on issues or goals to pursue or course of action that is agreed upon by a group of people who have the power to carry it out, enforce it, monitor it, etc. That's a broad definition of policy. So you can start thinking that in this case, for the sake of today's discussion, if somebody sees something, we know the issue, then it's almost like if you see something, say something and do something. So when you start noticing something, it becomes almost, I call it, it's an ethical duty to say something so we can do something about it. So all those observation points, unfortunately, does not rise up to a set of actions which can either make a difference or prevent a harm or help us most efficiently use resources that are in hand. So all policies should have an outcome. So why are we making policy? The policy should ideally lead to some outcome or prevent a barrier or make some change. So that's where I feel nurses are in a very unique position. Now, then why there is a gap? I started thinking about this question. I'm a naturalized citizen. With 200 questions, they let me into this country, right? So with 200 questions, you get your citizenship test. So a lot of things we don't know how this policy making works. So it could be that we are not exposed to how policy making, or it could be that we are not in a position where we are able to take our observation and make it translate that into an implementable action. Or somebody else is in that leadership position, they think only they can make the policy. And what are the different ways in which we can engage? There's a disconnect between those two. So I have used this approach called E plus three C's. In our medical profession, healthcare profession, often we talk about statistics and p-value, etc., and say this is not statistically significant. Unfortunately, policymakers and human beings in general, communities listen to emotional story. You have to take an emotional story and connect it to a level of emotion. So everybody in the nursing profession has an emotional story to recount. So because we watch that, people connect with another human being at an emotional level, not at a statistical level or cognitive level. So everybody has an emotional story. Every statistics is nothing but a human story. So there is an emotional story which is very powerful, which either motivates human beings to act in a particular way. So that is one advantage we have, because the ones we serve, our patients, share some of the most intimate personal suffering story with us. Nurses have credibility because they have the highest honesty, ethical standard, training, etc. If a nurse says this is it, people are tend to follow more than what even a doctor advises them, because they spend time with him. And they can, with confidence, say, if I do this, this is the outcome, right? If you wear mask, this can prevent this. So there is a way in which they can say with compared to somebody else who may have a different point of view. So they can really distinguish themselves, saying, I know these actions can lead to say. So in any forum, when the community looks at a nurse trying to say, this is how I will approach it, they are likely to see the difference between that and someone else who may connect the dots in a different way. So at every level, they can start noticing the contrast. And then connection with human beings comes so naturally for nursing staff. Nursing staff ultimately comes down to a relational business. So they can connect with different sort of people, not just I connect with only people who look like me or sound like me. They can connect with pretty much everybody. It's almost like their training, there's a gift of connection.